Hi everybody, so I'm Steve Miller from Sports Physio, and I'm just going to talk you through some of the trauma and life-saving equipment that we use at Newcastle Falcons. So over here on the left-hand side, this is the trauma bag that we use. So within here, this is predominantly managed by the medical side of things, so the medics will be in charge of this. Inside of there is the airway management stuff. We have the wound care and wound management stuff like the suture kits. We also have the collar that you would use for extricating a player with a neck injury or a spinal injury, as well as a lot of other bits of equipment in there, like the medications, the drugs that can be administered by a doctor. Other things that you will want, ideally, again, it depends on your budget, but this is an ideal scenario. This is a SAM Pelvic Sling, or SAM Splint, as it's known. Basically, you have on your floor, or 5 more, your pelvis is a huge area that can bleed, as are sort of the long bones as well. So around that sort of proximal femur territory and pelvis, really, that will stabilize the pelvis to stop the bleeding or reduce the bleeding somewhat. Other things that clearly you will be fairly familiar with are crutches. So again, if you want a partial weight bear, non-weight bear somebody, these are a really useful option. Couple of things just to check with this, again, are making sure that the handles are okay. We used to apply a little bit of foam and a little bit of tape around here just to add a little bit of, so there's less pressure through the wrist really. And you just may need to make sure that the ferrules are all in working order. Just a couple of demos of those that are a bit worn really from there. And obviously these are adjustable to the height that the athlete requires. A knee splint, again, for any knee-related pathologies or injuries that you want to stabilise. Really useful having a option that has the angle that you are limiting that range of motion at, so that maybe that you don't want any movement at all in a knee, so therefore you can brace that accordingly. Some of them will allow a hinge up to a certain angle. Other things for upper limb injuries, just your slings that, again, people will be fairly familiar with. Used to have a lot of AC joints or upper limb pathology stuff in there. You've got your air cast boot, which again has an inflated section inside. So what you're doing is you're obviously picking the right size and then you are pumping up the inside so it splints and braces that lower limb. Accordingly, any ankle injuries, foot injuries, anything that you think that maybe just needs stabilizing, again, a really useful option. These are the life-saving bits and pieces here as well. So this is your AED or your defibrillator. Really important to check that the battery life is at least half on that before you are embarking, and that should be done on a weekly basis as a bare minimum. The pads need to be in there. You need to make sure that they are sticky and that they have been maintained. Other bits of life-saving stuff that you need to check, just for example, are oxygen and also this, which is your Entonox. So Entonox is something that you would use to maybe sort of relocate a joint if it was appropriate to do so, and they were neurovascularly in check. And then obviously the oxygen, that again needs to be at least sort of half full. And again, it's been checked beforehand. The last thing just on here really are your sort of support, so your back splints really. Again, you're going to just pick whichever one you want to use. You're going to mould it round whatever limb it is that's injured, and then what you're going to do is just draw out the air with that, which will then cause it to harden. So you can see there's a pump attached here, and in a very easy sort of fashion, basically pumping it out the air, that will solidify, and then you can package that accordingly and get that off to A&E, hopefully preventing any sort of worsening of the situation. But hopefully that gives you a little bit of a flavour of the trauma and life-saving equipment that we would use here at Newcastle Falcons. Hope you've enjoyed it. Hopefully you use it to your benefit and gets you ready for the sport reopening again.